Molecular biomarkers, and we've looked at DNA repair biomarkers, urine biomarkers, circulating biomarkers. I think they're going to be very therapy specific. So the biomarkers that we've developed at Foxchase are DNA repair biomarkers, and they're really relevant to MVAC chemotherapy and GemCis chemotherapy, so platinum-based chemotherapy. Will we need new biomarkers in the era of IO combinations or IO single agent therapy or IO antibody drug conjugate therapy? I think we will, and I think we'll need to continue to evolve those to keep up. Right now, the molecular biomarkers only serve to take the proportion of patients who we think had a clinical complete response and conservatively shrink that if they don't have a mutation. We don't use it to say someone with disease on biopsy or on imaging is fine because their biomarker is fine. So it's kind of adds a conservative approach to this. And I think that will be the role of future biomarkers as well, just to sort of hone the population of patients who we think have a complete response with more certainty.